Hello, welcome to One Smart Nurse. Before you continue to watch the video, please read the disclaimer in the description below. Today we're going to talk about Bell's palsy. Bell's palsy is a partial paralysis on one side of the face caused by an inflammation and swelling of the 7th cranial nerve. The nerve becomes so compressed and so inflamed that it becomes damaged. The Bell's palsy has a rapid onset, and the majority of the patients do have complete recovery. However, if contracture of the muscle occurs, partial recovery can occur. Bell's palsy can recur in one's lifetime, although it is extremely rare, and recovery time for the elderly is also slower. Bell's palsy can affect any age, but the most susceptible are pregnant women, those with diabetes, those who have a cold or the flu or other respiratory infections. The cause of Bell's palsy is unknown, but may be related to a virus such as the chickenpox, herpes, the flu, also Lyme's disease, a brain or facial tumor, a bacterial infection, or autoimmune disease that can cause an inflammation to the nervous system. Now, Bell's palsy has several symptoms. It affects the eye in that you would have tearing or drooping of the eye. You can also have difficulty opening and closing the eye, which can then cause drying and a corneal ulceration, which can end up resulting in blindness. So that is one of the things we're going to talk about in terms of treatment options at home. For facial symptoms, you can have pain to one side of the face, drooping of the face and the lips, difficulty speaking or having a slurred-like speech. Your mouth can have a change in taste and drooling. You can have ear pain or sensitivity to sound, and other symptoms include headaches. Diagnosis of Bell's palsy is based on the symptoms that have been mentioned. However, you can talk to your doctor about having an MRI or a CAT scan to rule out a tumor or any other cause of pressure on the facial nerve. Now, Bell's palsy treatment goal is to maintain facial muscle tone and prevent further nerve damage. This is not a stroke, and recovery can take 3 weeks to several months and even up to a year. The first thing you want to do is to remove the cause of the damage to the nerve. So for example, if you have a tumor, the option might be surgery to decompress the pressure on the nerve. Additionally, you may want to have an antiviral medication such as valsarclovir or acyclovir. Other meds include corticosteroids such as prednisone. Prednisone helps to reduce inflammation and swelling to the nerve and the blood vessels, which then results in reducing pain, reducing the severity of the paralysis, and helping to prevent permanent nerve damage. Additionally, you may want to have good oral care because you want to prevent oral and dental infections. Also, you want to protect your eyes, so you should wear sunglasses, use natural tears eye drops, and wear an eye patch at night. This helps prevent drying of the eye, which can result in a corneal ulceration and blindness. For pain, you can try wearing applying a warm, moist compress. And you can also take, for pain, Tylenol, extra strength, and NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. Additionally, you may want to speak to your doctor about a physical therapist for facial massages and facial exercises to help maintain muscle tone. And you may want to discuss with somebody, seeing a therapist or talking to somebody, as the individual may need some emotional support due to change in body image. Alternative treatments would include L-lysine and vitamin B12 to help with nerve healing. Please seek immediate medical care. If you have any form of paralysis, don't make the assumption that it is Bell's palsy. You always want to rule out a stroke before you make the decision that it is Bell's palsy. Thanks for joining me at One Smart Nurse. Comments are welcome. Please check out the references that I used to make this vlog below in the description. Don't forget to subscribe and hit that like button. And I will see you next week for our new topic on the next vlog. Thanks and have a great day.